name is Amy Jennings, and I have an occupational therapy doctorate. I work primarily in hospital-based outpatient care, and most of my clientele is the neurological population. So anything from stroke to brain injury, multiple sclerosis, Parkinson's, some peripheral nerve injuries. And I do work in a very rural area, so we do a little bit of everything. We have a wheelchair clinic that we run here, a driving safety program, the LSVT big program, really a wide range, and I get a lot of variety in my day. I live and work in north central Washington state, and we are a rural area. We service anything from Seattle to Spokane, all the way up to the Canadian border. So we have a lot of people who are traveling to our valley for their health care, and our organization has everything along the continuum of care. We do acute care, hospital, inpatient rehab facility, home health services, and outpatient services. Well, just to share a quick story with you, I was folding my son's laundry the other day, and I hear him from across the room holler, "Mom, you're not doing it right." And I absentmindedly just keep folding and think, what am I not doing right, sweetie? But he comes over with more conviction and says, "Mom, that's not how Alejo does it." And I had to chuckle a little bit. Alejo is an au pair who lives with our family and helps take care of the kids during the day. But one of his responsibilities is to help with the kids' laundry. And I laugh because at age 3, we don't like the change from one person folding laundry to the next person. And I realize at how young we really need the routines and habits in our lives. So when something so big as coronavirus hits our country, we all have this drastic change happening. So when you ask what has changed, I think of the roller coaster that we've been through these last several weeks. My day specifically has changed in the world of technology, has become so much more important. So I get to work and I have my patient list just as normal, but it's mostly doing a lot of phone calls and video calls and connecting with people virtually. So we've expanded to a lot of telehealth, which has been difficult and navigating a lot of bumps along the way. However, we do see the value of this as well because we are a rural community with a lot of remote patients. I see us using this a lot more in the future moving forward. Also, we have started doing outpatient in the home. So with those patients who can't necessarily get into the clinic or can't connect virtually, we are visiting them, and that's been another big change for us. We are treating every aspect of that illness. We are seeing people in the ICU, in the PCU, and then getting them to the appropriate rehab facility or home, and then following up with them on the outpatient side as well. The majority of the education that I've gotten has come through the AOTA resources. So I've taken advantage of the different seminars and webinars that they have offered. I've also got some education through various other stakeholders in occupational therapy, such as LSVT Big has offered some different seminars that have been helpful as far as COVID patients and telehealth. Also, different companies that make a lot of rehab equipment, such as Sabo and Flint Rehab, have offered webinars suggesting how we can move forward with home programs for our patients. So most of my education has been some self-discovery in reaching out to different organizations offering different options, but I've been very appreciative of what AOTA has put out in their decision guides and recommendations for moving forward. So my setting is mostly outpatient, and my biggest thing right now is doing some video visits, one-on-one through either we use an Epic EMR system, so we are able to connect with people through the MyChart app, or we can use a DoxyMe or a Zoom program. And the first couple of sessions I had were very glitchy from my end, just not really knowing how to do therapy with someone when I can't get my hands on them. You know, we always want to feel how someone's tone is, or we want to stretch someone out. And it's much more challenging when we can't do that. But I have come up with somewhat of a routine that I go through once I do connect virtually with someone. And we have been starting with some deep breathing exercises. So these are really powerful for physical and mental health, but also given the times and the stress that people are going through, the deep breathing has been very powerful. So I am starting each of my telehealth sessions with just a few minutes of deep breathing and relaxation strategies. And then I'm moving on to just a gross motor warm-up that can be performed either seated or standing and graded based off the person's ability. But we're going through some good range of motion and stretching and some balance challenges if they can do that. And then I'm moving on to some more patient-specific goals. So I have done a variety of things through telehealth, which I never thought I would be doing, but I've administered the MOCA exam, the MVPT assessment. I've done ocular testing through the video, the range of motion testing, obviously. And then I've even got to do some ADL and iADL work through the video. So I'll ask a patient to don a jacket or their socks and shoes and kind of be able to observe and make recommendations based off what I'm seeing. I've also had people be able to show me their kitchen and how they're doing, reaching into cupboards, maybe making some coffee, kind of whatever those things they're doing at home anyway. And it's neat to kind of get to see their setup at home and work through some of those things and just offer advice through the video. My number one resource would be AOTA, and going to their COVID page, looking through all the different resources that they have posted. They have put on some different decision guides and algorithms to help you make those tough decisions. And then also the community forums. We have a state community forum as well as the national AOTA forum, and those have been helpful just to see what other people are doing. I think my biggest piece of advice is just engage in knowledge sharing as much as you can. We really can't keep moving forward unless we know what works and what doesn't work. So if you can share what you've learned, I think that's very powerful. As OTs, I think we're creative people, but we need to keep sharing those ideas to inspire more ideas and keep that creative momentum going forward. So I really encourage you to share what you've learned and let us all benefit and grow from it.